friends, welcome back to my channel The Medical Stores. Today's topic is going to be on respiratory system. So today we will be looking at some few tests which has to be done in respiratory to differentiate between the obstructive and restrictive diseases. So let's get started. So before we go to the obstructive and restrictive disease, it is important to know what are different types of lung volumes, what they mean, and what are their definition. So first we will look at this lung volumes. So here you can see a diagram showing us different types of loops. So first is tidal volume. Now what is tidal volume? It is nothing but a volume of air exchange in each resting breath is called as tidal volume, which is this one. Like the normal breathing process which we do during rest, like just when we are sitting and we are inhaling, exhaling, that amount of volume is known as tidal volume. So second one is inspiratory reserve volume. It is amount of air inhaled above the tidal volume is called inspiratory reserve volume. So here you can see this was our tidal volume. I have given you number 1, and our definition tells us that the amount of air inhaled above the tidal volume. So it's normal tidal volume, and above the tidal volume, the amount of air inhaled above the tidal volume is inspiratory reserve volume. This is inspiratory reserve volume. Third one is expiratory reserve. It will be opposite of that. Amount of air exhaled below the tidal volume, right? This one, third one. This is expiratory reserve volume. Now fourth one is volume of air still left inside after maximum exhalation. So when this is our tidal volume, which is normal inspiration, expiration, this is inspiratory reserve volume, this is expiratory reserve volume. Now once we have exhaled air out, there is still some amount of, like little amount of air which is present in our lungs. That volume is known as residual volume. It tells us volume of air still left inside after exhalation. That is known as residual volume. I think this is logical. Like you cannot exhale full amount of air through your lungs. Like if you will exhale, our alveoli will get collapse, and that will lead to emphysema. So normally when we exhale out, there is still a minimum number of air left in our lungs. So that amount is known as residual volume. And we have few more concepts, but they are not that much important. So it is inspiratory capacity, which means tidal volume plus the inspiratory reserve volume. Functional reserve capacity, it is expiratory reserve volume plus the residual volume. And the total capacity is one thing, total lung capacity, it is inspiratory capacity plus functional, like you add all of this, and by adding this you get total lung capacity. And you have one more thing called vital capacity. It is nothing but amount of air you can bring in. Like to calculate vital capacity, you have to apply this formula: total lung capacity minus the residual volume. You will get the vital capacity. It is nothing but amount of air you can bring in, like how much we can inhale, the amount of air, the maximum amount of air. That is vital capacity, and that you can calculate by this formula. It is total lung capacity minus the residual volume. Now there is a test called the spirometry. We use this to differentiate between the restrictive, obstructive disease, asthma, and COPD type diseases. We can differentiate them. So spirometry is just we get a ratio of FEV1 by FVC. What is FEV1? It is nothing but a volume of air exhaled in 1 second. So the air which you can exhale in 1 second is FEV1, and FVC is the maximum exhaled volume achieved in 6 seconds is FVC. So this is how you can differentiate between the obstructive lung disease and the restrictive lung disease. So FEV1 to FVC ratio, if it is less than 70%, so that means it will be obstructive lung disease. If it is more than 70%, it is restrictive lung disease. This is how you can differentiate. But while we will be doing videos for asthma and COPD, at that time I will clarify this more specifically, because you differentiate based on this, and also many more criteria are there. So just remember this thing, that the FEV1 and FVC ratio is also known as Stephenio index. Stephenio, how you spell that? Stephenio index. Okay, it is important, like remember it. Now this is how you differentiate between the obstructive and restrictive disease. So first we will see what is basic difference between them. So obstructive lung disease, by the name you can understand that there is obstruction. There is obstruction in our pathway, so it is difficulty with expiration. So just remember, obstructive disease means there is difficulty in expiration, difficulty in fully emptying the lungs, difficulty doing it at fast enough rate, and importantly there is air trapping. Like, it is logical, if you are not exhaling amount of air outside, so you will be trapping that air inside. It will lead to diseases. Involves mechanical obstruction of the airways. So what are obstructive diseases? We have asthma, COPD, cystic fibrosis, we have emphysema, chronic bronchitis, bronchiectasis, and physical examination, like normally we will hear wheezings, rales. Mainly wheezings are more common in obstructive diseases. Now the restrictive one. In the restrictive disease, there is difficulty in inspiration. Why there is difficulty in inspiration? Because in restrictive diseases there is damage to the parenchymal tissue of the lungs. That's why we have difficulty with inspiration. It cannot fully fill their lungs as a result of disease. Stiffer lung parenchyma involves diseased tissue or physical impediment to expanding the lungs, so cannot expand the lungs. And what type of restrictive disease? Interstitial lung disease, sarcoidosis, scoliosis, obesity, and many more we have. And physical finding in restrictive, we will hear crackles, there will be decreased lung sound, there will be shallow breathing, and chest X-ray. Now this is one table which you can differentiate between the obstructive and restrictive disease. So first is spirometry. Spirometry should be done in both. You can differentiate between spirometry, which we saw, like the ratio FEV1 to FVC ratio. If it is less, it will be obstructive disease. Chest X-ray. In obstructive disease, you have this methacholine challenge test. It is most probably for asthma. When you give this drug to a patient who is asthmatic, that patient will react to this drug, and there will be decrease in airflow to the lungs due to bronchoconstriction. So that is a positive test for asthma. In restrictive, most probably you do biopsy. And you have bronchodilator response in obstructive diseases. You give patient the bronchodilator, mainly the short acting one, which is albuterol, and if the patient goes well with that drug. If you give that drug and the patient is well within 10 to 20 minutes, then it is obstructive diseases. In restrictive, you do bronchoalveolar lavage. The last one is carbon monoxide diffusion capacity. It is just a test which detects the passage of our air which goes through the lungs to the red blood cells, and it is probably normal in all diseases, but it is decreased in only 3 types of diseases. One is emphysema, interstitial lung disease, and pulmonary vascular diseases. So only these three diseases in which you find DLCO, that is carbon monoxide diffusion capacity, decreased: emphysema, pulmonary vascular diseases like hypertension or embolism, and interstitial lung disease. So just remember these 3 diseases. So most probably important here is spirometry and this 2 test, methylcholine challenge and bronchodilator response. So this is short in which you can differentiate, but when we will be doing asthma and COPD, we will differentiate it more clearly. So here we finished our video. So I hope you like it, and see you in my next video. Thank you.